All right, welcome back.
Hi, guys. My name is Dr. Callie Hale.
And I'm Dr. Kyle Hale.
And we are here today to talk to you about sleep disorder breathing and anxiety.
Mm-hmm. I'm anxious.
Why? Because I'm going to get on a soapbox again?
Yes. You're listening to this and you don't know that we're having to record this for the second time because we had some data loss issues. But learning curve of doing a podcast and also being full-time everything. We're not full-time
Literally.
one thing. We're full-time many things. So,
Yes.
and thank you so much to who's helping us do all
Our incredible videographer and editor. We love you.
So we are talking about sleep disorder breathing and anxiety. They are possibly related. We did do a fun...
Definitely related.
We did do a fun little... I'm going to just talk about an anecdote because we did a fun little... what's it called? I got you and Dr. Katie Mathis in a hot seat, and I had y'all do some things. This will be coming out on our YouTube. So if you follow on our YouTube, you'll see this come out in as a short. But I asked Dr. Callie Hale and Dr. Katie Mathis.
Actually, Dr. Katie Goldberg.
Oh, Katie Goldberg.
She got married.
Yeah, a long time ago. I gotta get better at that. But she, y'all two answered. I had a pop-up and I Googled something, and I Googled a couple of things. I won't give away too much, but one of the things that I Googled was, will my child grow out of
X?
Yes. And so one of the things I said, will my child grow out of is grinding their teeth at night.
Yeah.
And the number one Google hit was, yeah, absolutely grow out of that by the age of 6. Was it 6? Yeah, because I Googled, will my 5-year-old stop grinding their teeth? And they said, yes, by the time you're 6. It's a magical birthday. You'll find out that a lot of things will auto-resolve on your 6th birthday. So I went and had them answer that. But I was on my phone and I was reading about what, I can't remember, was it? I think it was a hospital in Pennsylvania or Philadelphia. And they said something like, well, just make, they were talking about a 5-year-old, and said, just make sure they don't have try to resolve their sources of stress.
You really catapulted with that. And I think Katie and I were like, okay, well, and you were like, are you kidding me? Do you have a 5-year-old? No, make their room more zen, more calm.
Talk to their teacher, maybe evaluate your parenting style. And I'm thinking my 5-year-old is hot and cold, hot and cold, hot and cold, hot and cold. And there's nothing stressful about, at least our kids when they were 5. I understand a lot of kids can go through a lot of stress at 5.
Absolutely.
But if your kid's grinding their teeth,
but yeah, teeth grinding separate.
I think anxiety is secondary to teeth grinding. And sleep
they're both linked heavily to sleep disorder breathing. So that's a good segue that you just did. So very good.
Good. Oh, I did that on accident. Go ahead.
But with anxiety, I mean, whether we're talking about with the kids or even adults and related to sleep quality, I like to, with the parents, use the example of, do you remember what it was like when you had a newborn? Do you remember what it was like when you didn't sleep well and you were woken up multiple times throughout the night? And how easy it was to cry and be sad and be so overwhelmed because you just didn't get the rest. And the sleep architecture, which I reference a lot, is so important. Like you need proper deep sleep, light sleep, and then REM and, everything that happens in between those hours. And when our kids are struggling so much to sleep at night and they're constantly being woken up and they're constantly being disturbed, they're not going to be ready for the day. They're not going to be ready for the day. They're not going to be ready for the emotional and physical toll that their day has ahead of them at school and dealing with friends, any age. I don't care if they're 6 and have struggling with anxiety, or they're teenagers going through the hardest time in their life, figuring themselves out, and they're also sleep deprived. So, depending on the ages, I don't care if it's an adult or a kid. I really don't, because it's going to be so similar. It's just, as an adult, we can manage the side effects of poor sleep way better than a kid. We can recognize when we're tired. We can recognize when...
Well, we know when we slept like crap.
Right.
Because then we can tell people, hey, I woke up on the wrong side of the bed this morning.
Right.
Watch out.
I'm cranky. But the kids are just going to react. They're going to lash out. They're going to cry more. They're going to throw fits. They're going to throw tantrums because they're exhausted. And they're going to manifest anxiety differently. So for example, in the dental chair, if they're coming in and they're going to have work done and they're scared because they have that immediate threat of, danger happening to them. They're afraid the shot's going to hurt. They're afraid, whatever. That's a different form of anxiety than that, because it's an immediate fight or flight. It's an immediate, she's about to stab me or something, which I don't do that, but versus anxiety because their brain is just overstimulated and on overdrive. Like they just haven't shut off, that they've constantly had sympathetic nervous system firing throughout the night when they should be resting. And, I have a patient in particular who came in to see me. He was already being treated successfully actually with his sleep apnea. And he was outside of the practice. Yeah. He's using CPAP and loved it. And I tell any dentist, like, your job is not to try to get everybody off of CPAP. That's not what this is about. Your patients need better air. And I tell them whatever form of that air you choose, I totally support. So if your patient's happy on what they are, don't try to talk them into something else. I mean, if they need, combination therapy with oral appliance therapy and CPAP, well, that's different. But he came in and was just raving about the fact that, he finally felt better, and he struggled with anxiety since he was a teenager. And he's sitting in my chair at 35 years old, and he's been taking depression, anxiety meds, Zoloft since then. Wow. And when he got his CPAP, he got off those meds.
So when did he get his CPAP? When he was 35?
Yeah, 30s. Yeah. Wow. He'd been on it for like maybe a year when I met him. Wow. And that entire time he'd been taking medication to combat a sleep issue, and he was off of it. And he's like, I can't believe I don't have to take that stuff. It's fantastic. So that's why it's no different with kids. I mean, I talk about all the time. I'm like, we've got to stop telling parents that kids are going to grind their teeth and they'll grow out of it, right? Or that their snoring is normal and they'll grow out of it. Like, that's preposterous. Like, we wouldn't have snoring adults if we didn't have snoring kids. We wouldn't have tooth grinding adults if we didn't have tooth grinding kids. So stop telling people they're going to grow out of it, and let's fix it, right? So that's the same thing for me with that. It's like, if we can get the kids sleeping better, we've done our ADHD posts. Everybody's already listened to that. If we can get them off of pharmaceuticals, I don't care if it's a bedwetting medication, anxiety medication, or ADHD medication. If we can get to the root cause, that's what we need to be doing. Period.
Done. All right. See you later. So how does anxiety look like if you're a dentist out there? Because this is something, like, since our first episode came out, and now we're having to re-record this. It's been a while, but, and this is the order that we want to do this in. But why am I getting so many messages from dentists asking, how do I screen? Because, like, this is not what I do in my clinical practice. This is what you do in your clinical practice. Yeah. And I'm just thinking, like, that's a great question, because I'm not even asking not asking any of, like, when I was seeing new patients regularly, and I would see a parent, like a mom or a dad who had young kids, I wouldn't ever think to ask, how's their sleep? And so we're sitting here, we're talking about anxiety. What's one way that you can bring up, like, say you've got it's on the very traditional pediatric sleep questionnaire. So we're screening for that. So like, you're saying, how are you screening?
Literally, that's the first one. Yeah. Is that when they walk in the door, they fill out their medical history and a sleep questionnaire. It used to just be a medical history.
Do you think parents fill out their kids' medical histories and stuff better than their own?
Yes. The moms fill them out way better.
Every single one I read, they got like one big line right through all the
yeah, because they're like, I'm fine. And that's very common. That's a completely different issue. But when they're filling it out for their kids because they're coming to see me for that issue, they are thoroughly filling it out. I mean, we have a fairly extensive questionnaire for newborns when we're evaluating for frenectomies, for breastfeeding. So these are like, 7-day-old babies or whatever. And with the kids, they definitely fill it out. If everything's zero, but I preach on this a lot. If everything is zero or like there's a line through it, they're not even filling it out, I still ask the questions. Because if I go in and I'm looking at the teeth and I see a whole bunch of things screaming at me, I mean, I don't care if they put zero or whatever, I'm still going to ask them. And what you will find, that's why I tell every dentist, like, please ask the questions anyway. What you will find is they didn't really know why they were filling it out, and they didn't do it thoroughly. or they didn't know the answer because their kid's 9 and they don't sleep in the same room anymore. So it was just like, well, I don't think so. Well, I don't think so. And then also some of it's just like, well, I don't want that to be true. So I'm not gonna put that down. I don't know if that's a thing. And so it just opens the door for the conversation, period. So those questionnaires are good because the ADA is called that we are screening. So now we have evidence that we are screening for sleep disorder breathing and sleep apnea across our practices. But even if it's 0, it doesn't stop me from talking about it.
So what's something that you're seeing, like I'm a new dentist or totally inexperienced dentist at this, and your patient has checked that, or your parent of your patient has checked that they've got anxiety, their kid has anxiety, or let's back up and say, no, they don't have anxiety. They're 12 years old, but they're taking some kind of medication for anxiety. You can look at that. We know that's, dentists know a lot about pharmacology too. So they see that they're taking an anti-anxiety medication. Maybe it's a 14-year-old on Wellbutrin or 12-year-old on Wellbutrin, something like that. And you see that. How do you start that conversation with the parent? Like, maybe this teenager's already been in interceptive ortho, already had their first bicuspids.
Well, now you're really thickening the
dude,
what do you want me to focus on?
I want you,
You're thickening that's a good.
I want you to answer a bunch of the questions that I'm
Right.
getting about,
Right.
and it's a dentist and they
Right.
don't know how to have these conversations with their patients.
Yeah. So, I mean, if it's a branding patient, you have no experience with them, you don't have a relationship with that child or that parent, and which is most of the time for me, because I'm just inundated with new patient consults and screenings. Mm-hmm. You just have to bring it up. They have filled it out. The patient's a minor. They're with their parent. Their parent and the patient knows that they're on medication for this to help them. So you don't make it taboo to talk about. I think the way you approach the conversation with the parent is, as I'm doing my assessment and I'm going through the medical history, I will say, okay, I see that we're using something to help us with depression and anxiety. So I'd love to know how long you've been on that. We're asking the parent, how long have they been on it? And is it helping? Is the medication helping? I have treated patients, successfully that have ranged from has attempted suicide to just really depressed, and they're trying to work through that. And so I think depending on the severity of their mental health issues and what they're struggling with, you have to know as their provider, because in the instance of the really severe one that I'm thinking of, it was necessary to get on PAP therapy, an older teenager, right away, because I wanted an immediate relief to remove the delay and waiting on appliances or whatever the protocols were going to be for that patient right away. And that's so rare, guys. I mean, I do more of this than anybody. And you just can't wait sometimes. That's an outlier, but this is a sensitive topic and we have to be ready for that. If they're saying, no, it's worked great, we've been on it for a year and we're really happy. Okay, great. Well, let me tell you what my goals will be as we start your child's expansive treatment. What we have seen is that anxiety has improved once the sleep improves. And I do a sleep study on all those cases. And a lot of the times when I'm talking about pediatric care, I'm really not referencing sleep studies as much, because my end goal and treatment plan really rarely changes, because the majority of the patients that we see, the majority of the kids, are going to be a very straightforward upper and lower jaw expansion, fix the swallowing, breathing, tongue ties. I know I made that sound like it was a lot of things, but it's kind of just like this whole package. The muscles and everything need to work well, but there's going to be an outlier set of kids that I can identify as, this is severe. Surgery is needed for tonsil nanoids, or we're on our third school, which we talked a little bit in the sleep disorder breathing podcast. Mm-hmm. And so when they're really severe, you need all your information. You need a sleep study, and they've never had one. So that's another thing. And even if they're fine and they're not there for an airway consult, and you see that a child is on anxiety medication or depression medication, it's a good idea to offer us a sleep study just to make sure that you can't help in some way. And usually my verbiage is just, look, we've seen a big link with that, and I want to make sure she's got, everything she has or everything he needs while he's sleeping, that everything's functioning well, so that this isn't part of the problem. And it's just something we can check off the list so that we know that's okay. And that's part of the discussion I have with them, because the sleep screening with a sleep study is so simple and so valuable.
So I think that was awesome. Guys, please help me out, because I don't know not enough. And I'm really just trying to listen to what you're saying. And if I was listening to you in my car on my way to work, what would be my next question? That's always so frustrating when I'm listening to a podcast
And you want to ask
any
a question.
interview,
I know.
and the interviewer just lets like some big thing just slip on through, like all of us are on a cliffhanger, and then they're like, okay, well, in
I'm
our
just
next
glad you're paying
episode with our
attention.
new guest. So, I guess what I want to switch over to now is, let's see, one thing that while you were talking that I realized is that a patient who's on any kind of really anything for anxiety, it's not an oral appliance. So you're not going to be replacing anything or asking them to do an alternative therapy. And so I think this is
what do you
well, I think this is a big deal because it's like you don't say, hey, you have to come off your Wellbutrin to do oral appliance therapy.
what? No,
Right.
no, never.
So you can do this and get all the benefits, which a lot of them, at least on the surface, are cosmetic, right? Because this is ortho.
Yeah.
And so you're getting all these cosmetic improvements, but you're also getting a lot of functional improvements, which is your ability to breathe through your nose, widening the arches, developing the face to where your genes, when you were born, wanted it to be. And you don't have to stop taking this medication. And so I think a lot of parents listening to this don't want to, maybe they've had some dark moments with their kid that has anxiety,
Of course.
dependence on the severity.
Right. Oh, yeah.
And they don't want
Well,
to
I don't-
do anything else because they're in
Right.
a good place now.
Absolutely. No, and I think that's a good point that you bring up because I definitely don't discontinue meds I don't prescribe, for one. So I'm not even part of the let's wean off or let's change. That's totally outside of my scope. Mine is let's see if we can find a reason for why they might be struggling so much and improve that daytime ability to manage their life. I mean, I tell even the adults that come in that are tired, I'm like, look, you cannot repair emotionally and physically from your day when you stop breathing multiple times per hour. You can't. So your tank's on E, you go to bed, you fight for your life all night. Your tank's still on E. You get up and now you got to go make important decisions. You got to pay bills. You got to deal with rude people, cutting you off on the freeway. And so yeah, like, no, I'm not saying let's mess up what you've already done well and figured out, and like, no, but let's do the sleep study. Let's treat some of the underlying symptoms and just see if things get better. And I work with the physicians with that 100%.
Awesome. I don't really know what else to ask you.
Yeah, I think that's a good one for anxiety.
Yeah.
Yeah.
I'm trying to think if okay, so I'm a dentist and I'm listening to this.
That's
I'm
true.
like,
You are.
on Thursdays, just Thursdays. When, or not when, but what helps me understand the anxiety and the sleep disorder breathing connection more? Is there a resource you like, or you could send anyone listening to this to or towards?
I mean, a very simple Google search will pull up tons of published articles. So I usually tell people if you're wanting a physical hard copy of something, well, then just dig into the literature because you'll find it. There's other podcasts, there's other information out there on anxiety and sleep disorder breathing, really the anxiety depression discussion. It's one of the biggest reported side effects of people that have sleep disorder breathing and obstructive sleep apnea. So
this seems super obvious.
Yeah,
if
it's
I was
very
gonna
obvious. Yeah.
I think when I was doing my training, it was like 11 respiratory events per minute was normal. And so, cause this is something we track whenever we're doing sedation. And so we're not you can't ask a patient how many times you're breathing. Right.
Oh yeah, no, exactly.
And you can't
so
also
you just
tell
have to do
them
the sleep study.
hey, I'm going to watch you
100%.
breathe.
Right.
And so what we do is we sit in the corner and we ask them about their day, and then we count, usually to 15 for 15 seconds and see how many breaths they took, multiply it times 4.
Right.
And then in my sedation record, that's what I'm writing down. 11, sometimes 13 would be higher because maybe they're talking or they're nervous. But if you have to breathe that many times per minute, just awake and just sitting in a chair, and that same person, I ask them to hold their breath as often or half as often as they're having these sleep apnea
I've tried.
events.
I've totally tried. Yeah.
And just
it's
watch
crazy.
them. I bet they start sweating and going crazy in our office. 'cause
Heart
they're
rate
already
goes up,
stressed
all the
out.
stuff when they're, yeah, definitely.
So, I
This
guess
was fun.
Yeah, that was fun. We're done.
Stay tuned.
Bye.